Sure. Just to welcome everybody to our July CPI for the Northeast. It's so great to see many of you again. I loved meeting you guys in July, or actually, excuse me, in June. I'm getting my months all mixed up. So welcome. Bring to the next slide. So we are starting to record this. So just FYI on that. And then we'd love to have you introduce yourself in the chat. You can put your name, your organization, and then our icebreaker for today is going to be, what is your favorite go-to lunch? All right, Toby, I'm not seeing your lunch item there in your chat. Maybe it's coming. So we're looking forward to today's session. We have a lot of things to cover, as always. So we're super excited you're here. And again, feel free to raise your hand, put your questions in the chat or comments. We want this to be a good conversation for everybody. You can go to the next slide, please. So as you all know, we're trying to host a space here for our regional CalAIM stakeholders to collaborate, identify challenges, and problem solve. So all kinds of good actions going on. And the goal is to really improve our CalAIM implementation in the counties here and drive utilization. So I would love to open this up, and if we have somebody who is new to the CPI group, if you want to maybe come off mute and introduce yourself, I would love to get to know you. Anybody new? All right, looks like we have a bunch of veterans here. All right. Great, glad you're back. Ava, I'll let you go ahead and introduce the two new staff members.
Yeah, great. Thanks, Gretchen. So we just wanted to introduce everyone to the newest members of our CPI team. We have Bailey joining Health Begins, who is our new VP of Medicaid Strategies and Initiatives. And then we have Kyron, who is a program manager on CPI. So you'll see them joining sessions and office hours. So I just wanted to introduce them to you all, and we're excited to have them on the team. Next slide, please. And so just to give everyone an idea of what our objectives for the session are today, and actually I'm just going to pause really quickly. I know that there are a lot of fires happening in your region that are impacting a lot of folks, and if they're not impacting you directly, I'm sure that you know someone who they're impacting. So we just want to, extend our thoughts to everyone. We really hope that you and your loved ones are safe. And if at any point, you need to step away or, anything, just let us know. And we're happy to, support you during this time, because I personally know how hard that is. So just wanted to extend my thoughts there. But I'll go back to our objectives. So by the end of this session, our hope is that you all will receive important funding opportunity updates and resources, as well as learn best practices related to funding by engaging in a peer spotlight and taking that opportunity to ask questions. And then you'll also have a chance to receive updates and provide feedback about upcoming events. Next slide, please. So to give you a sense of how the agenda is going to go, we're starting now with some level setting. We'll move into talking about those funding opportunities and pathways. We'll touch on updates and share some resources, and then close out with some next steps and talk about some upcoming events, office hours, and how to reach out to us if anyone wants to have a one-on-one with our team. Next slide, please. So we had a really great session in June. Thank you so much for everyone who attended. And we just love having in-person events because it's really an opportunity for everyone to connect and establish strong relationships and learn from one another, share a meal. And so we wanted to share some reflections both from facilitators of this section and attendees. On the facilitator side, we really saw that there was a really high level of engagement. We had a really wonderful presentation from Partnership, so thank you for that. I see Ashley's on the call. Thank you, Ashley. We had really robust conversations about provider referral coordinations. We'll follow up on those in a minute. And we really want to make sure that we move forward, leveraging this shared momentum, continuing those conversations and building together. In terms of attendee reflections, what we heard from you all was that you really loved the opportunity to peer network, you really loved the opportunity to engage with partnership, and that it was an opportunity to learn which organizations in the community are offering which services, and that moving forward, if we want to make sure that we are creating more opportunities to discuss ECM implementation and payment models. Next slide, please. And I will pass it over to Gretchen now.
Thanks, Ava. So again, it was great to see you all and get to meet you in person in June. I wanted to do a quick recap of the things that we covered in June. I think it's going to help inform some of our conversations later today. And if you weren't able to make our June in person, hopefully this will catch you up so you're not feeling like, what the heck's going on? So we did a little referral mapping exercise in June, looking at what are the top organizations or programs that we receive referrals from for ECM and community support, and have a nice list here of all the folks who are referring to us for ECM and community support. If you want to go to the next slide. We also talked about the organizations that we're making referrals to for ECM or community supports. And I think one of the things that we don't have up here, but I definitely heard from all of you in June, is that you are doing self-referrals. So you are having folks come into your organization and you are making a referral for your ECM or community support services, which is great. Next slide, please. And the piece that I want to focus our efforts on today is looking at who are the organizations that we identified in June that we want to connect to for ECM or community supports, either as a provider or as a referral partner. So looking at who those folks are, and then also identifying folks who are missing from our collaborative table. So who do we think should be part of our conversation, part of our efforts for service implementation, part of our efforts for referral coordination to build those referral pathways so we're reaching as many folks as we can. So I want to take a moment and just pause here. I also want to open the floor up a little bit to see if there's other organizations that maybe aren't on this list that maybe you've encountered since our June meeting that we should add to the list, or if there are organizations for folks who weren't at the June meeting that you want to put up here. So I'm just going to open it up, and please come off mute and share which organizations you think should be on this list that currently aren't.
It looks like Eric has his hand up.
Okay, great. Thank you, Jared.
Yeah.
Excuse me, sorry. my computer's a little slow today, so it's not updating, forgive me.
Yeah, you can throw our organization on there. We don't have a lot of personnel in Shasta, but we're definitely there. Kingsview, 2 words.
Great.
Thank you.
Thank you, Eric.
And I think also No Boundaries is doing enhanced case management now, and I believe short-term post-hospitalization as well too, so they'd be a good one to throw up.
Okay, great. Anybody else who we think is missing from our table or who we'd like to connect to for ECM or community support? Again, either as a provider or as a potential referral partner for our services.
Sorry, I missed a meeting, our last meeting, but I wasn't sure. I don't see it on here if we have the 24-hour home care as another place, because they provide respite services in their agency.
So we want to bring them to the table then, it sounds like, for the CPI group. Great. Anybody else? All right, well, I know that we have a lot of folks here, and I think what we've been talking a lot about is how do we sort of take steps to really improve our referral coordination, to improve our referral pathways. So we're going to do that again. I'm going to turn over to Amber to help us talk about what are some potential next steps here.
Yeah, so one of the things we were thinking of is specific to Shasta County, where we have a lot of providers in, and Who else? I know we have someone from Eastern Shasta from Pitt River, but who, and Eric, I know you guys you have a presence here, but you're from another county, but who else is here from another county? Like scrolling down, do we have anyone here not from Shasta? Okay, don't want to leave anyone out. So some of the feedback I've been hearing just like out in the community is that it does feel like we've done a really great job, like getting a good wide breadth of folks in there, but maybe we're not all familiar who's in there, and there's like, we're trying to figure out like how we're all going. Oh yes, Dignity, you guys you represent a lot of counties, Christina. But that we need to figure out a better way to all coordinate together. And so one of the ideas was for us to take some folks from that previous list, and we could be ambassadors to reach out to them. I know there's been some talk about Health Begins maybe being able to draft a welcome letter. And then we but working off the relationships that we already have, could invite those partner organizations. And so we could get the best like saturation and representation at these meetings so we can figure out how to work together. So how does that feel for everyone? I take silence as you hate it and will continue to offer other options, just so you know.
I think that sounds like a good place to start.
Thank you. And a thumbs up. I got 2, so we're good to go. So I think also, Gretchen, do you want to walk us through what the QR code could be though, as well too, now that we know that we've got some folks who will be willing to do the connections?
Yeah, so I think there's a lot that we can think about. So I think Health Begins can definitely draft a welcome letter. What is a CPI, not a CPA? Why is it important? All that good stuff. And then we can, share that with you guys so you can be the best ambassadors for bringing folks to the table so we can coordinate all of our efforts. And one of the pieces I think that's really important and part of this conversation, as you all identified as a need, was doing a provider registry for everybody. And so that we can all enter our organization's information, what services we're providing, which populations of focus we're working with, which counties we're serving. And then if you choose to, you can also identify a point of contact for your organization. So if folks do have questions or want to make referrals for ECM or community supports, they know who to reach out to directly. So I want to say thank you to the organizations that have already put their information into the provider registry. We would like to open that up to folks, not just contracted providers, but I think folks who are part of our community, our ecosystem, and making ECM and community support successful. So we can definitely, identify the QR code. I'm having a hard time talking today. I'm sorry, you guys, and share that broadly. So you'll see that there. Want you all to enter your info, and then we can include that with our invitations as well. Any questions on the provider registry? Anybody have any challenges using it? Hey, Marcy, thank you. I'm glad you. Yep.
Oh, go ahead.
So go ahead.
I just was going to say, I think one of the things we're working on our end is just to really get in the habit of checking that as a really routine thing. And I think also when I'm hearing folks out in the community talk about that they do ECM or that, they're doing any of the community supports, is also encouraging them, like, forward the link on. I think that's going to help. The more we just continue to share it will be helpful.
Great. So do we want to have folks volunteer to be our ambassadors for certain organizations? How do we want to organize our efforts here?
I think it would be helpful if we could go back to that list and maybe we could just jot down some names real quick and based on like who knows them. It probably shouldn't take that long is what I'm thinking. So who has a good relationship with Adult Protective Services that we feel like we could reach out to them and invite them to this process or kind of take their pulse on their involvement with ECM? I'll come back.
We do at Connected Living. I can get somebody to make that connection.
Okay, cool. That'd be awesome. And if you run into any roadblocks, Christine, I can help out as well too. So let me know. We've been going to their MDT.
And we
Alicia-
have been too.
Oh, awesome. Alicia, do you want to connect with Good News Rescue Mission?
Yeah, sure, I can do that. I was thinking a lot of these organizations also attend our local continuum of care, so maybe it might be good to have a conversation at the COC meeting as well.
Yeah, maybe we could do it in public comment.
Mm-hmm.
Do you
Love
want to
that
take,
idea.
yeah, do you want to take lead on that?
Do I want to take lead on it?
Mm-hmm.
Sure.
Okay. I'm meeting with Shasta County Children's Services because we're expanding in the children's population. I have a meeting with them like in 2 weeks, so I can talk to them then.
Okay.
Toby, who do you think would be good for Visions to reach out to?
On that list,
Yeah, or anyone else that we maybe are missing?
nobody picked Far Northern yet?
Not yet.
Yeah.
Cool. I know the new harm reduction director at the Rancheria, so and she's working with Churn Creek Healthcare, so I can reach out to her.
So we are
What
the
about-
county's food bank. So if you needed us to be involved somehow from the food bank perspective, we're happy to do that. And we also do have a relationship with the VA. So if we needed to do that piece, we can do that as well.
Perfect. Allison, Rebecca, or Sarah, or April, are there organizations here that you think we're missing or would be good for you to reach out to?
I think they were good.
Okay. What about you, Marcy? Is there an organization that you feel like you could reach out to? Maybe Shasta County Office of Ed?
Yeah, that would be good. I can do that.
Okay. And I think, isn't Northern Valley Catholic Social Services involved on some level?
I'm not positive, but I think that they're a referral source,
Okay.
but
So-
don't quote me on that.
Marcy, would you feel comfortable reaching out to them too and just kind of getting their pulse on stuff?
Right, and this is to find out if they are providing the UCM services or the CS services. I missed that part.
Yeah, and also just invite them to these meetings so that we can all like have the widest representation.
Sure. Yeah, no problem. I can get a hold of both of them.
Cool. And then Gretchen and Ava and Melissa, in the interest of time, I think we've got like half the list and we've got COC is going to hit a lot too. So maybe we can just regroup on this. Does that sound good?
That sounds perfect. I think we can see what we get, and I'm looking forward to this. And then we'll email to the group the invitation language you can include in your email, the QR code for the provider directory, so we can start to have that all available to you all to use in your correspondence.
I can reach out to Empire as well.
Oh, great.
And I'll do no boundaries as well too.
Hey, good afternoon.
Awesome. So we'll try to get out to you by the end of the week in terms of the invitation language, and then you can start doing your outreach, and then we'll look forward to regrouping and hear how it goes next month and see if you had any feedback from folks, maybe why they didn't want to attend or, you know, what happens, and hopefully we'll have some new faces. I'm looking forward to it. Bailey, did you want to jump in here? I see you came off mute.
No, thank you. I just wanted to say, we appreciate everybody sharing your resources and points of contact, we know it can only make the program better.
Great, thank you. All right, love the action steps. Okay, we're gonna get some things going here. All right, next slide, please.
All right, so I can, oh, go ahead, Gretchen. I can jump in here. We're gonna just, we wanna provide some information about some funding opportunities. We're gonna focus on Cited and TA Marketplace for today, and then also kind of let everyone know of some opportunities coming up where you can ask questions, specifically related to TA Marketplace. So for anyone that is not familiar, Cited is serves to support the transition, expansion, and development of ECM and community supports capacity and infrastructure. And then we have the TA Marketplace, which is a virtual one-stop shop where you can access hands-on and pre-designed technical assistance to support with CalAIM contracting and implementation. Linked here in the sheet is a DHCS funding cheat sheet that will have a lot more information. We're going to kind of go over it at somewhat of a high level, but when you receive the deck, the slide deck later, there will be additional slides, a lot of additional information, and you can always reach out for questions as well. Next slide, please. So just to provide a little bit more information about the eligibility criteria for Cited, excuse me, in order to receive Cited funding, the applicant must be actively contracted to provide ECM and community sports or have a signed attestation letter from the MCP or other entity that they intend to contract with in order to provide services in a timely manner. So to give everyone an idea of who these eligible applicants are, and I imagine it's most folks in the room, this can include community-based organizations, county, city, or local government agency, FQHCs, Medi-Cal tribal, and designee of Indian Health Program, providers, and others as approved by DHCS. And as I'm sure most of you know, especially those that may have applied, round 3 awards will be announced in the fall. Next slide, please. So also, as we're thinking ahead to round 4, we want to highlight some common denial reasons that folks receive. We're going to highlight 3 here. The first is that the applicant's request did not clearly demonstrate alignment with cited goals. So please keep this in mind if you're planning on filling out an application in the next round. Another common denial reason is that the applicant was seeking funding in a highly competitive area, and the applicant did not meet funding priorities in this round. And then the third that we're going to highlight today is that the applicant did not provide the required ECM and or community supports contract. For more information, or if you have questions about common denial reasons, we've also included the email address for the cited team on this slide as well. And Amber, do you have anything to add here? I know that you earlier kind of mentioned that you might want to add something regarding common denial reasons.
Yeah, I think just in general, in general for when you're applying for PATH, if you choose to, is I would just really encourage everyone to read through the categories, what's allowed, what's not allowed. There's a lot of really specific instructions, and to really make sure that they're in alignment with the cited goals. I know some other funding applications have been able to do a nice broad stroke that you can use, and these ones are really specific dollars. So I just would really make sure that you've set aside the time to slow down and look that over.
Great, thank you. Next slide, please. And I'll pass it over to Gretchen.
So we wanted to also get some local perspective on PATH Cited, what's been successful. And so we've invited Lisa Schaefer from Pathways to Housing to talk to us about her experience and her organization's experience with applying for PATH-funded funds and being successful in getting their award. So Lisa, I'm going to turn it over to you to kind of share kind of pros and cons, what's worked, what hasn't. Let folks know how things are going with your PATH FIDA grants.
Okay, thank you. Thank you for having me here. Okay, so this was the first time that we've applied for PATH funds. We were awarded in round 2. All of my milestones that I applied for were all for upfront costs and purchases. So I didn't apply for any kind of ongoing like salary support or anything like that. It definitely has been very helpful in allowing us to purchase some of the bigger things that we're needing to get. Operating off of a really small budget. We're a really small nonprofit. One of the things that we were able to be awarded for was the purchase of a vehicle to allow us to transport goods and donations and things of that nature. We also were awarded dollars to purchase a refrigerator and a freezer to aid in proper food storage because we do feed all of our residents here on site. So that's a constant thing, keeping our food stock up. We were also awarded dollars for a new computer system and software to help with our invoicing and TAR submittals. Let's see, we were awarded for some maintenance costs to aid in the upkeep of our facility. 2 of the things that were kind of challenges during the application process and the awarding process is we were denied for 2 of the items that we applied for. And in having one of the biggest challenges I think that I have experienced is probably just with the communication through email. A lot of times the questions would be time sensitive and, you know, as busy as everybody is, I've experienced some delays in communication feedback. And sometimes I had a hard time trying to explain what the situation was and having the cited team kind of understand the scenario. And I think that is just how email communication goes sometimes, but the specific examples where we were denied tools. We asked for a bunch of maintenance tools to help with the upkeep of our facility. And the response that we kept getting back was that it was an ineligible use category because it was not meant for personal use. And they kept being under the impression that I was wanting to take the tools home and use them at my home. And I kept trying to explain that it was for the respite house. So I think just having real clear communication when you're trying to communicate those things. But I did find that as a challenge. And we also asked for some food dollars to buy food, but we were denied that also because they were saying that fell under an entertainment category, and entertainment wasn't an eligible use. So they were making the correlation of us feeding our patients with the entertainment category. So those were some of the challenges with the application itself. The application is long. It's very detail oriented. So like Amber said, I would just really slow down and make sure that you're putting enough time and being prepared when you're creating your milestones. Make sure that you're paying attention to your milestone completion dates as well. I did just submit my Q2 report, but I got to be honest with you. I don't know if it's going to be accepted or if I'm going to have some revisions. I have had to do revisions on all of my reports, but I've been able to get through them with the guidance that the cited team has provided and a little clearer direction. The portal the reporting system is not particularly user friendly. So again, I would just say be really prepared when you're going in to do your reports. You know, make sure that you have your timelines matched up. Make sure that you you know, have all of your records for easy referencing and things like that. It was mentioned that, you know, there's other grants that are kind of more broad based out there and are more flexible. So just keep in mind that this grant is very specific, and you do have to make sure that you're following what you stated in your application. I'll give you another example of a challenge that I'm facing right now, and I can't really speak to my interaction with PATH with the team, because in all honesty, I haven't even gone down that road yet to try to connect to problem solve this. But it's a problem I'm anticipating. So we were awarded for a vehicle, and so we've been out vehicle shopping, but I haven't actually been able to find the exact one that I applied for. I have, however, found other things that would suit our needs. But I held off on purchasing because in the back of my head, I thought, well, that's not exactly what I applied for. So I better get in contact with the team to make sure that, you know, I can vary the vehicle. So that's kind of the next hurdle that I'm getting ready to jump right now. So, but other than that, I'm very grateful for the opportunity to have, you've been awarded and to be able to enhance some of the things that we're being able to provide here to the respite patients. And without this grant money, we definitely wouldn't have been able to make some of those bigger purchases that we're now able to do. So.
Well, that's great, Lisa. Thank you for sharing. And one thing that I find really interesting about your applications, it sounds like you were just denied certain things, but the rest of your application was able to be approved. And that's a really important point to be.
Yeah, I had 7 milestones that I applied for. We were approved for 5, and we were reduced to funding on 2. One of the ones that we were reduced funding on was the computer system, and this was interesting with the response that came back as to why it was reduced. So I asked for a software package and then kind of like a supercomputer, if you will. And we were reduced funding on the computer amount, and the reason that, so I only asked for 1, but they came back and said that they approved me for 3 desktop stations at a much reduced price. And so I tried to have communication back and forth, you know, trying to get clarity on that. And that was another thing I wasn't able to get clarity on. So I'm going to go ahead and buy 2 more desktop stations.
Yeah, that sounds great. I appreciate you sharing. And I think, Lisa, but I also want to open the floor up for other folks who've applied for Cited, either successfully or unsuccessfully, to jump in and share your thoughts about the PATH Cited process. And I think it's important as we think about, you know, round 4 coming up, we want to make sure we all go in eyes wide open. So if we are thinking about applying for the last and final round, that we can understand kind of the reporting process. And Lisa, I think your examples of what you had reduced funding for some were not approved. So thinking through all of those possibilities. Christina, I see you have your hand up.
Yeah, thank you for inviting me here. Hope any of that was helpful.
Very much so.
So we have applied for all 3 of them. We were awarded the first 2. Of course, we were eagerly anticipating round 3. But the first one, we really focused around training opportunities and just really building some infrastructure here. And so with that, we applied for grant funds to help getting people additional training in how to be either community health workers or things along those lines. We also requested some funds for iPads in order for us to be able to have some technology be able to travel out in the field. That was one that we got reduced funding amount versus what we requested. I don't know if anyone's tried to buy an iPad recently, but they are almost twice the expense of what we were awarded money for. So that's been a super fun adventure. In Path 2, we really focused more about getting a program that was going to be able to help us do some case management and data collection along with being able to start staffing up a little bit more and getting some desks and, you know, just equipment that we really need to continue expanding our services. So we were awarded pretty close to everything we asked for on those, but we had the same issue as Alicia as far as getting enough money for anything that's technological. Computers, they cut almost in half of what we had requested. And again, I don't know of any computers that you can buy the entire desktop setup and everything for like $500 a pop. So at least not one that I want my staff using more than maybe a year. So it's been a little bit challenging for some of the realistic portions, especially when we give them quotes. But other things they've been able to give, I feel sometimes when you're a little bit more vague, that really helps because in Path Grant 3, we did request a vehicle too, but we, instead of saying, hey, this is the make and model that we really want, we gave multiple examples of ideas of vehicles that we're hoping to obtain. And so that way we don't get landlocked into one particular vehicle we're not able to find in the future. So sometimes being a little bit more vague, yet still being able to provide multiple quotes has been successful for us.
Christina, when you put your application in for a vehicle, didn't you have, oh, I'm sorry. Maybe I'm just registering. Did you say you provided multiple different quotes? Okay.
Yeah. Yeah, because we knew we wanted something that was going to be able to travel up in the mountains a little bit more and something that was going to be gas efficient. So we already had like a list of things that we wanted, but we didn't say we want the Honda, whatever, like we didn't say anything in particular we had to have. We said, you know, here's a quote of Hondas or Toyotas or Kias or whatever. We just gave them multiple quotes to the vehicles that met the need that we really needed.
That's great. Thank you, Christina, for sharing all of that. And I see, Toby, you have your hand up.
Yeah, when Visions of the Cross got the cited and we put in for a bunch of things, but on the vehicles, what we did is we went down to one of the local car dealerships and got 2 quotes because we were putting it for 2 cars. And then when they approved it, we didn't get the same cars. We just had to stay below that quote that we got. And then we're trying to the money that we saved on those vehicles, we put in to allocate that extra money to a different area.
And did you get approval for that from the cited folks to repurpose those dollars? We
haven't got that yet. There's a few things that we're trying to repurpose because we came under budget on a few things. One of the things that they did deny was the technical. We put in for a couple tablets, but they approved like 8 cell phones for us, and they said the tablets, which we were going to use to be able to do outreach in, they said that was kind of a duplicative of the cell phones.
Andrea had something in the chat as well too, and so did Christina about reporting. And I would agree with. So we got past cited 1. I would agree with your comment, Christina, that reporting is also interesting because the platform updates each time. So I would really encourage everyone to print out when they're done with their report. And it's a weird template. It's not your standard grant template, but print it all out, because when you go to do your new one, especially if you have milestones that like staffing costs, you have to report kind of each time. So you're going to want to make sure you have what you did before. Otherwise, you could lose track of some of your milestones or some of your funds. We did ask to repurpose some funds or change a position. So it was a sort of repurpose, and they did approve that. So once you figure out the communication and that piece, like, I do think it works. It's just, you have to, it's a different process than probably a lot of us are familiar with.
One thing that we've kind of discovered is they're looking to see that you can spend as much as that you've been granted, without having to give the money back. We didn't ask for the upfront funding. It's all reporting and milestone based, but that's another option too, is to ask for the upfront funding on the grant.
These are all great lessons you all have learned, and I really appreciate everybody sharing them. And I see that we have a great chat going on. Christina, you're sharing a lot of good information, so appreciate you doing that. And I think, again, we're hearing this from multiple people that they really want to have folks spend the money they were awarded. So figuring out how to make sure you can do that, I think, is a great exercise. Anybody else want to share anything? I think, Andrea, you agreed with all the IT issues that have been raised, how you guys weren't funded for enough for the 8 desktops you required. So yeah, I think that's proving to be common, unfortunately, that they're underestimating what the cost of these items are for folks.
Yeah, I'll jump off mic and say the same thing. I don't know where they're getting quotes on laptops from, but everyone got their prices shaved down. We kind of chuckled at how much they thought our laptops would cost. And to the woman that was speaking earlier, you can usually redo your milestones, and you might want to redo your vehicle milestone to the more vague one. You know, we'll buy a vehicle for program, and the analysts or whoever's doing the review of the reports, they're pretty accommodative of that kind of stuff because our milestones change dramatically. We got a lot of IPP and HHIP from everywhere. So just say you're going to get a vehicle and then buy one for equal or less, the lesser the amount that's on the milestone. Yeah, there were some weird denials, and then I had questions come in from our application on cited 3 about 2.5, 3 weeks ago, and it seemed as though they don't understand what an HIE is, but I don't know that that was either them challenging me or what. The portal is rough too. I'm going to echo everybody in here. We have 5 or 6 things going through PCG and Grants Connect right now, so if we didn't have to live in that portal a little bit, we wouldn't know it either. But it's not our favorite thing to use.
Eric, I like the idea of them challenging you with their questions. I'm going to keep that framing.
I'm trying. It feels like a reach.
Can I ask a question about just changing that? That was a good idea, a suggestion to change the milestone to just a vehicle in general. So how would I do that? Would I close that first milestone and then no? I'm seeing some no's.
Start with the email to PCG. I think number 1 step is reach out. Hey, I want to do this. Tell me where and how. And then we in here, I don't know that I could articulate it because it's someone else on the team, but Amber looks like she was about to jump off mic and tell you. She could probably tell you how to actually do it.
Thank you.
Oh, there's 2 different ways we've done it. One, and Christina, you may have different experience. One, when you're doing an update, but I don't know if you want to wait till your next update, it'll say like, did you meet it or do you need to change it? And that's like the easiest way to do it if it's in an update. Like, so you click on the box, I need to change it, and you put the change in there. The second is we do exactly what Eric did, is we send an email, and sometimes they'll count your email communication. And then when you do your report, that's when you would like fill it all in at that point in time. But once you get the email back saying like, that's fine, then you can move forward then, and you just address it in your report.
Okay, that's exactly what I was going to do. Great, thank you.
All right, great questions and answers. Thank you all. Ava, I'll turn it back over to you.
Great, thank you. Just wanted to highlight, actually, Navneet, if you can go 1 slide back. Yeah, just wanted to highlight that Cited Clinics Awards were recently announced, and any Cited Clinics eligible applications that were not awarded under Cited Clinics will also be considered for Cited funds. Round 3 awards will be announced in fall 2024, and then round 4 is underway, so stay tuned. Hopefully we'll know more about that soon. And then I know, Amber, do you want to share any last things that you think are really important to highlight before we move on?
I think the main points have like already been hit in terms of like, go slow, figure out your routine. One of the things that PATH does is it does give you access to the TA marketplace, which is also a learning opportunity. And I know we're going to spend some more time later on talking about those pieces of it. However, it is a great way for smaller nonprofits who want access to tools to kind of be able to access that. So make sure if you are awarded PATH, that you also continue on the learning journey for TA Marketplace.
Great, thank you so much, Amber. All right, Navneet, we can go to the first poll, I think, and just to get a sense of who is interested in applying for Cited Round 4, I'm gonna launch this poll, and if you could just take the next few seconds and just let us know if yes, you will be applying, no, you will not, or if you need more information. And I'll give it a few more seconds. And then I'll close this poll out. All right, so it looks like most folks are interested in applying, and if you need more information. All right, that's great. Thank you. Next slide, please. All right, and I will pass it over to Gretchen.
Great, thank you. I know we just have a few minutes left, so I'm going to be a little brief here. But as Amber mentioned, not only does PATH offer the Cited grant fund, but they also have this TA Marketplace, which I'm going to promote, even though I know it's a little clunky to use, but I think it's a great resource. So TA Marketplace, what they've done is they have collected a bunch of vendors. Health Begins is one of them. And they've been approved to offer TA services in various domains or areas where they have expertise. And what this enables you all to do is go and shop for what TA you need, what vendor you may want to work with, and then apply for that to the TA Marketplace, and then the state will pay the vendor to provide services for you. So instead of having to pay a consultant, you can have the TA Marketplace do that for you. So I really encourage folks to look at it. They have a couple of different modalities they're working with. Some are active now, some are not. But I think it's a really exciting opportunity that we'd love to have folks take advantage of. It is a bit overwhelming when you log on for the first time. There's many, many vendors, many types of projects available. I think it's a good idea to think about what does your organization need and really hone in on who provides those types of services. Or if you have an organization you've worked with before for consulting or TA services, you can look for them on the TA Marketplace as well. And we do anticipate that those applications for TA services will be accepted through 2026. So you don't have to jump on this now. You can do some more thinking as your program evolves, and as you decide to expand, you can look for those TA services as well. Next slide, please. I know I'm going to see if maybe we should hold our questions. You may want to do a deeper dive on the TA Marketplace. Speaking of which, we do have office hours tomorrow. We are doing for both our CPIs Northeast as well as our CPI in San Joaquin and Stanislaus counties. And we're going to have the TA Marketplace team come to the office hours and be available to answer questions, to guide folks through the process. So I would love to hear your questions. We can hopefully then collect them for the office hours tomorrow, or you can save them for that. But I encourage you to look at the website before tomorrow's office hours so you get a sense of who's on the marketplace, what is the structure of it, see what's available in terms of how do you apply. They do have guidance. I find it very difficult to maneuver. I am a vendor on the marketplace as well. I still find it challenging to kind of figure out where the right screen is to get the information that we need. But tomorrow, 10 a.m. to 10:45, we're going to cover some cited information. We're going to cover TA Marketplace, including having the PCG team come and answer questions on that. Ava, Amber, anything to add here?
Main thing is, for all the folks on the poll who said that you need more information, like this is a carved out space for you to get it. And I don't know about you, like I have a long list of things that I want to research and gather more information on. And that's often the first thing that gets triaged off when I'm in the middle of emergencies. So like, this is a nice opportunity that the time is already booked.
Great. And Christina, I see you just put in the chat that you just kicked off your TA Marketplace. Do you have any tips about how to make it streamlined or not?
I have no tips on this one yet because we literally just started, but it was really cool to have the consultants come out here and just really tell us like what all they're going to be engaged in. They basically kind of feels a little bit audit-like, but at the same time, we know that the outcomes that they're really trying to help us with are positive, not just trying to catch us in something. So it is a little bit scary, I guess, but at the same time, it's really exciting to know that we can, you know, reach new heights, and being able to have a consultant that's paid for by the state is definitely a win for a small nonprofit. So.
Great. Well, I hope you learn tips and tricks you can share with all of us as you go through the process. So we'll come back to you on that one for sure. Ava?
Thanks, Gretchen. I was just putting the registration link for office hours in the chat for anyone that wants to go ahead and register now. So that should be next. Yeah, so we hope to see you tomorrow. But also if you have any like burning questions now that you would just like to send to us, we can make sure that we include them in the office hours for tomorrow, but you also have an opportunity to ask questions. Next slide, please. All right, so we're going to provide a few updates, mostly policy updates. Next slide, please. So the first one is an update on targeted provider rates. AB 119 authorized an MCO provider tax, and this revenue will be used to support the Medi-Cal program, including targeted provider rate increases and other investments to advance Medi-Cal. Questions or comments can be submitted to the targeted rate increases email box, and that's included here in this slide, so you'll have access to that once you receive the deck. Next slide, please. Our next update is an update on the 2024 to 2025 governor's budget. And we wanted to highlight that ECM and community supports were not affected by the budget cuts, and also that there is now a low-income housing tax credit, which provides $500 million for additional year of state low-income housing tax credits. And additionally, that budget summary is linked there. And the next slide, please. So also wanted to provide some information about Proposition 1. Prop 1 was passed in March of 2024, and it's a 2-bill package to reform and expand the California behavioral health system. And so the first part is the Behavioral Health Services Act, which is an expansion of the Mental Health Services Act to now include substance use disorder. And then the second part is the Behavioral Health Bond, which authorized $6.4 billion to finance things like behavioral health treatment beds, supportive housing, community sites, et cetera. And also I want to highlight on this slide, there's a link to sign up for the DHCS listserv. And so would really highly encourage everyone to do that, so you also receive these updates as they are released. I know that this is a lot of information, but all of those links are included there to go back and kind of look at them a little closer. Next slide, please. Also wanted to just pause here for a minute to see if anyone has any updates or spotlights that you would like to share with the rest of the group about anything happening in the Northeast. So I'll just take a moment, and if anyone has anything they'd like to share, feel free to put it in the chat or unmute. And Vanessa, I see that the link isn't loading, so I'll put an updated one in there. Christina.
Oh,
yeah,
I'm
go ahead,
sorry.
Amber.
Go ahead, Christina.
The mute button was not wanting to do anything there. Anyways, we just brought on a new interim supervisor, probably more than likely going to be made permanent in the next couple of months. We're really, really excited because our CalAIM program has been moving pretty scrappily, but still pretty firm since the beginning, but now we'll have a supervisor to really help keep us organized and focused on our goals. So just was exciting to share that information.
That's awesome. We were awarded partnership health plan dollars that we're going to use to focus in on the justice involved population. So we're adding a care coordinator to our team that's just going to be focused on justice involved. And we're also expanding in our health center to be taking referrals from our pediatrics department for youth as well. So that's like a nice expansion for our team.
That's awesome. Thank you both for sharing. All right, so I think we can go on to the next slide. And I also put the fixed link for office hours in the chat. So use that one for registering. As always, we know this is a lot of information. So if you are interested in scheduling a one-on-one with our team, we can talk about kind of an overview of CalAIM, overview of what the CPI does, strategies of effectively engaging with the MCP, or any other kind of support that's needed. Feel free to send me an email and we can set up some time to schedule a one-on-one. And then also we have office hours each month. And as we mentioned, those office hours are taking place tomorrow morning at 10 a.m. Next slide, please.
Eva, real quick, could that be included in the welcome letter? Just like some of the perks about that would be, I think, a really nice call out.
Yeah, definitely. And I think we actually have some of that language from other outreach we've done. So we'll pull that together. No problem. Yeah. So really quickly, we are hoping to schedule our next in-person session in September in either Lassen or Modoc. And just to get a sense of who would be available or able to attend, I'm launching a poll right now to see if folks in this room would be able or available to attend a session in Lassen or Modoc in September. But it's not letting me launch it. Are folks seeing that poll? Okay, it's not letting me launch. So if you could actually just put in the chat if you would be available to attend a session or not, that would be great. Thank you. Okay, great. Thank you, everyone. And if we can go to the next slide.
The poll did just pop up too, if that helps.
Oh, okay. Well, I think it'll maybe work for the next one, but thanks for everyone for putting your answers in the chat. So yeah, as I mentioned, we're hoping to have this session. It's in September. Oh, perfect. Okay, great. And we're looking at September 24th from 11 to 2:30 p.m. in Lassen or Modoc, and really hoping to, continue a lot of the conversations we started in our in-person in June, and would really love to see, if folks are available and can attend this session. Next slide, please. And so also to get a sense of if anyone would be interested in co-hosting our upcoming in-person session, you can go ahead and please respond to the poll that was just launched about whether you're interested in co-hosting the session, not interested, if you'd be available to help support the planning, or if you're interested in sponsoring the event, that would be great. And I know we're at time, but we're just about there. All right. And the next slide, please. And then as always, we just love to get your feedback about which section of today's session was most valuable, whether it was our provider referral coordination discussion, talking about cited funding, our provider spotlight, the TA marketplace, or policy updates. And if it's other, feel free to put it in the chat. All right. Thank you for responding to that poll. And then next slide, please. So next steps, please join us for office hours tomorrow morning. Continue implementing your improvement practices. And again, if any support is needed, please always feel free to reach out to our team to schedule a one-on-one. Next slide. And as always, thank you everyone so much for joining, for your engagement. Gretchen or Amber, any last words?
Great to see everybody.
Yeah, thank everybody, and hope to see as many folks as possible tomorrow.